Now, moving on to echo or ultrasound, there are three, or you can say four, echo or ultrasound features of tamponade. One is IVC being distended due to the pressure exerted by the fluid in the pericardial sac on the right heart chamber, specifically the right atrium. A small IVC almost rules out tamponade, so you can start with this relatively easier to obtain image. Second is invagination of the right atrium or right ventricle during diastole. So this is a long axis left persternal view of the SLE patient admitted to our to one of the services in teaching services a few days ago, the case that we discussed in the morning report. So in systole, you can see the nice round anterior wall of the right ventricle, which becomes clearly indented or invaginated during diastole due to the lower pressure during diastole. So the pressure in the pericardial sac will exceed the pressure in the right ventricle during diastole, and if the pressure in the pericardial sac continues to increase, then the invagination will happen even during systole. So this resembles what some people call the little man bouncing on the trampoline sign, as you can see here, basically causing the indentation or the invagination. Here is the same patient, but with this time with the short axis view, which also shows the invagination of the right ventricle wall during diastole. I slowed the video with the hope that to be a little bit more clearer to see. So again, during systole, the right ventricular wall is round. During diastole, it's invaginated. Systole and diastole is basically determined by the movement of the valve, right? So the mitral valve here will be closed during systole and will be open during diastole. So during the apical and subcostal view, after you move from the left persternal view, you go to the apical view and then to the subcostal view. So the first image to the left is the apical view, and again you expect to see the invagination in the right atrium before the right ventricle, because the pressure in the right atrium is lower than the pressure in the ventricles. So you can see that clearly here in the apical view, and you can see it also in the subcostal view, which also show the invagination in the right atrium. Now, the more important signs which need a little experience to do at the bedside is the accentuation of the normal respiratory fluctuations in peak transvalvular velocities. What does that mean? Remember when we talked about pulsus paradoxus and its physiology? This is the same thing here. During respiration, the negative pressure in the chest will draw blood to the right heart and increase the venous return to the right atrium. This will lead to more blood moving through the tricuspid valve, and thus the velocity across the tricuspid valve will be more during inspiration compared to expiration. Normally this increase is less than 40%. In the appropriate setting, when this difference exceeds 40%, then this is a tamponade physiology. Now in this example, while you're on the apical view, you're using ultrasound, you are in the apical view, you can use, or when you're doing the echo, you can use the spectral pulsed wave Doppler option and move the line across the tricuspid valve. Now, what is spectral pulse wave Doppler? The spectral pulse wave Doppler means you are asking the ultrasound machine to measure the blood flow velocity across the area that you picked, and in this case it's the tricuspid valve. Any flow towards the probe will be reflected by waves above the yellow line, and the flow away from the probe will be reflected by waves below the yellow line. It's called a peak E wave, and E stands for early diastole because it measures the movement of blood across the valve during early diastole, in which the blood moves from the right atrium to the right ventricle, and so this movement will be reflected by waves above the yellow line. In this case, as you can see, the peak velocity happens during inspiration, which is about 120 centimeters per second in this case, and this drops to about 60 centimeters per second during expiration. So the difference between the high velocity during inspiration and the low velocity during expiration is more than 40%, and this suggests a tamponade physiology. I hope I made it a little bit clearer. Across the mitral valve in the left side of the heart, the reverse happens. So during inspiration, and due to the larger venous return and bulk of the septum to the left ventricle, the venous return to the left atrium will decrease, and so the blood flow to the blood flow velocity will also decrease. In this example that we have, and once you put the spectral Doppler line across the mitral valve, like here, you will note that the flow is about 40 centimeters per second during inspiration and about 120 centimeters per second during expiration, which is more than the normal 25% or less drop during inspiration, which can occur in normal physiology. Therefore, a drop in the mitral valve peak EV wave of more than 25% during inspiration indicate tamponade physiology. Now, in summary, the echo or ultrasound features of tamponade physiology include: number one, a non-small IVC. IVC is usually large in tamponade, and then diastolic collapse of the right atrium, which usually precedes the diastolic collapse of right ventricle. These two can happen during systole as well if the tamponade is really bad. And then the fourth one is the accentuated respiratory fluctuations in peak transvalvular velocities. Now, the first three you should be able to obtain using our butterfly ultrasound device by doing the IVC examination and left parasternal views, the long axis and the short axis. But to the best of my knowledge at the time of this video, I think the butterfly added the pulse wave Doppler only to the vascular function, not the cardiac window, as far as I know. But I think my guessing would be that it might happen in the future. So I think it's still good to try to at least understand the principle of the peak transvalvular velocities. Okay, that's all what I have. Thank you very much, and see you in the next video. Bye bye.